Hello, I'm Dr. Victor Nava. I am a plastic surgeon and the Weight Clinic Medical Director. I would like to say a few words about the services that we offer, but first I'd like to tell you a little bit about myself. My parents are from Zacatecas, Mexico, and I tell people that I was made in Mexico, but I was born in New Mexico. Before I was one, my parents moved to California, and I grew up in Folsom, Orangevale, and Citrus Heights. I graduated from San Juan High School, and then I went to Mexico City. I did my pre-med there, and then I entered the School of Medicine at the University of Mexico in Mexico City. I then went to Mexicali, where I did my internship at the Social Security Hospital. I then went to a small town south of the border from Yuma, Arizona, where I did my social service year. I then came back to the States, took my entrance exam for my general surgery residency, and I did that in North Carolina. I also did my fellowship in plastic surgery in North Carolina. I opened up practice in 1988, and I stayed in North Carolina till 2002. I then came back to California, mainly because my family and my wife's family is in the Sacramento area. I now have my office in Roseville, and I operate out of Sutter Roseville Hospital. As a plastic surgeon, I do both cosmetic and reconstructive surgery. Some of the procedures that I do in reconstructive surgery are treat patients with complex wounds, such as burns that require skin grafts or flaps. I also do breast reduction in women who have very large breasts and have pain in their neck, their shoulders, and their back. I also do breast reconstruction in those women who have had cancer and have had mastectomies. I do body contouring, especially in those patients who have had a lot of weight loss, for example, after a gastric bypass. I also do hand surgery, mostly trauma, and I take care of patients with skin cancer and other benign skin tumors. Within the cosmetic, I do facelift, rhinoplasty, which are nose jobs, eyelid surgery, and ear surgery. I also augment breasts and butts. I do liposuction, Botox treatments, and filler treatments. I have a laser to take care of hair, fine wrinkles, skin discolorations, and spider veins. As I mentioned, I am the medical director of the weight loss clinic. The first one opened in 1973. So for over 40 years, they have been offering a program that is effective and safe. They currently have 4 clinics, one in Lodi, one in Elk Grove, one in Sacramento, and one in Roseville. Obesity is a terrible disease. It is the cause of more than 50 other illnesses, including cardiac disease, high blood pressure, diabetes, strokes, cancer, and many others. It makes sense then to treat obesity and hopefully minimize the risk of other illnesses. It makes sense then to treat obesity and you can prevent many other diseases. When you first come in, we do a history and physical and a nutritional analysis. We check your BMI, your percentage of fat. We measure your waist and your hips to determine their relationship. We set goals. The program basically has 3 parts. The most important are exercise and eating healthy. We also prescribe medication to help control your appetite. The recommended diet is nutritious and well balanced. Each week you are monitored to see your progress, and we give advice and recommendations as indicated. As you go along, you will learn how to stay on track for a long and healthy life. Remember, nothing tastes as good as it feels to be slim and healthy. And remember, nothing tastes as good as thin and healthy feels. And now I'd like to say a few words on life and health in general. As long as you are alive, you are aging. Simple as that. There are 80 million baby boomers born between 1946 and 1968. Apparently, soldiers coming home from World War II were a bit frisky. Our children say that we are old, but remember, you are as young as you feel. There are those who say that we begin to die the moment that we are born, that we have only a certain number of breaths and a certain number of heartbeats. I disagree. I believe that we continue to grow and develop well into our reproductive years. There are those who say that you begin to die the moment that you are born, that you have only a certain number of heartbeats and a certain number of breaths. I disagree. I believe that we continue to grow and develop well into our reproductive years. When we are young, we enjoy freedom and health. We can do what we want, when we want, where we want. Why? Because we can. We're strong, we're healthy, our mind is clear, our senses work, we have strong muscles, we're flexible, we're agile and less fragile. In fact, you could even say that we bounce. How many times did you fall when you were learning how to walk? You got right back up, no problem. But then comes middle age, around 40. And once you're past 40, we say you're over the hill. Our health begins to deteriorate. Our muscles get weaker. Our minds cloud. Our senses don't work as well. We begin to use glasses, hearing aids. Everything goes south. Our bellies get bigger. Our love handles get bigger. We're slower. We can't move around as well. Maybe we're too fat. Or maybe we're a professional couch potato. And certainly we don't bounce as well. In fact, when we fall, many times we break. But thanks to anti-aging medicine, we can maintain our biological age younger than our chronological age. Our chronological age is the actual age that we are. And our biological age is how we feel, how we look, and how we act. For example, you can have a 60-year-old Apache who looks older than a 90-year-old Buddhist monk. Why? Because the Apache spent most of his life out in the sun, and he has lots of wrinkles in his skin. And the Buddha spent most of his life in the temple, and his skin is as slick as a baby's butt. Unfortunately, the only way that you could stop aging is to die. But you know what they say, everybody wants to get to heaven, but nobody wants to die. So even though we can't stop aging, we can slow it down by choosing a healthy lifestyle. Throughout history, the cause of death has not always been the same. In the beginning, people died because a dinosaur stepped on them, or he got eaten by one. Before antibiotics, people died of infections, like tuberculosis. There are 4 groups of illnesses: infectious, like tuberculosis; congenital, for example, cardiac disease; or trauma, for example, a car accident. Would you like to live to be 120 years old? I'll take a crack at it. My birthday was yesterday, so I only have 57 years to go. Scientists tell us that the first person that will live to be 150 years old has already been born. But if I'm going to live to be 120 years old, I want to be healthy. I want everything to work. I don't want to be stuck in a nursing home, strapped to a wheelchair, with a tube in my stomach so they can feed me, another tube in my bladder so I can pee, drool down to the floor, and poop in my pants. If that happens, I hope I have Alzheimer's, because that way I won't have any recollection of my existence. And I call it existence because certainly that is not living. So remember, if you want to live a long and healthy life, you might want to change the way you think and the way you live. Because no matter how much modern medicine has advanced, if you don't take the first step, you're not going to make it. Life expectancy is 80 years. When is the last time you saw an 80-year-old person weighing 400 pounds? You haven't. They don't make it. They cut their life short by at least 15 years. So remember, take care of your body today, and your body will take care of you tomorrow.